of COVID-19. We know the Presidential Task Force press briefing just ended, and the response strategy of the Presidential Task Force Committee on COVID-19 shall remain focused on testing, detection, contact tracing, containment, slowing down the spread and management of coronavirus. Chairman of the Presidential Committee on COVID-19 and Secretary to the Government of the Federation, Boss Mustafa, stated this at the committee's press briefing. He said President Buhari approved constitution of an Economic Sustainability Committee on COVID-19 to be chaired by Vice President Professor Yemi Osinbajo. Meanwhile, Nigeria has recorded its second death from COVID-19. Minister of Health Dr. Osage Henry, who announced this, says the patient had underlying health condition.
Developed and is being constantly reviewed as dictated by developments.
Boss Mustafa there giving us an update on the situation of COVID-19 in Nigeria. But the federal government has directed the cessation of all movement in Lagos and Abuja, the nation's capital, for an initial period of 14 days. Now, the lockdown, which also affects Ogun State due to its proximity to Lagos, begins at 11 p.m. on Monday, that is today, 30th of March. President Muhammadu Buhari, who gave the directive in a nationwide broadcast, said the measure is aimed at containing the spread of coronavirus pandemic in the country. Let's hear from State House correspondent Adamu Sambo, who has all the details.
The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis.
As a nation, President Muhammadu Buhari said Nigeria's response to COVID-19 must be guided, systematic and professional. And in doing so, he emphasized there is no such thing as overreaction or underreaction, rather the right reaction by critical institutions of government and experts. He said with Lagos and the FCT having the highest number of confirmed cases of coronavirus, cessation of all movements is imperative.
All citizens in these areas are to stay in their homes. Travel to or from other states should be postponed. All businesses and offices within these locations should be fully closed during this period. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states.
The restriction order, he said, does not apply to institutions and individuals on essential services. President Buhari explained that the federal government is fully aware that such measures will cause hardship and inconveniences to many citizens. He was, however, quick to add that with the dreadful situation in other parts of the world, this is a matter of life and death.
We must all see this as our national and patriotic duty to control and contain the spread of this virus. I will therefore ask all of us affected by this order to put aside our personal comfort to safeguard ourselves and fellow human beings. This common enemy can only be controlled if we all come together and obey scientific and medical advice.
President Buhari announced various palliative measures to ease the pains of those whose livelihoods will be affected by the restrictive measures in the coming weeks, while directing the Ministry of Humanitarian Affairs to develop strategies towards sustaining the school feeding program during this period. The President also ordered the immediate implementation of a 3-month repayment moratorium for all trader money, market money, and farmer money loans.
I have also directed that a similar moratorium be given to all federal government-funded loans issued by the Bank of Industry, Bank of Agriculture, and the Nigerian Export-Import Bank. For the most vulnerable in our society, I have directed with the conditional cash transfers for the next 2 months be paid immediately. Our internally displaced persons will also receive 2 months of food rations in the coming weeks. We also call on all Nigerians to take personal responsibility to support those who are vulnerable within their communities, helping them with whatever they may need.
The federal government, he said, is committed to doing whatever it takes towards confronting COVID-19.
I want to assure you all that government ministries, departments and agencies with a role to play in the outbreak response are working hard to bring this virus under control.
President Muhammadu Buhari thanked all healthcare workers and other essential staff on the front lines of the response against the global pandemic for their dedication and commitment, describing them as true heroes. From the State House, Adamu Sambu, NTA News.
And to talk more on the President's broadcast, we have in the studio David Akoji. He's from the National Orientation Agency. Thank you very much, Mr. Akoji.
Thank you very much for having us.
What would you make of the President's speech, especially as the infection rate increases daily? We just recorded another death from the Presidential Task Force press briefing we had. What should Nigerians deduce from the message of the President?
Well, the President is offering a message of hope. Is offering assurance with regards to the fact that government is actually on top of this situation and that everything that is necessary is being done to ensure that casualties and infections are minimized. The President is stressing the fact that we need to do our part as citizens by abiding by the policies that government is putting out and various experts, on the control of this pandemic. Policies such as the necessity to wash our hands, to observe social distancing, and then to stay at home.
And part of staying at home, we know that lockdown begins today.
Yes.
Now, before this lockdown decision was taken, we see people go about their normal businesses like they don't care, so to say. What has the NOA been doing about that in terms of enlightenment? Well,
we have been doing quite a lot at state capitals across the country as well as at local governments. The big challenge actually is in the rural areas where there's challenge of running water. And you actually need running water to get a proper hand wash. So how we have gotten around this is we've encouraged people in the villages, in the markets, to set up tanks and put tap heads, and then put water in this. As you open that, you have a running water situation and you can use soap, and properly wash your hands. So this is what we're encouraging the folks in the rural areas, to do as a measure towards preventing themselves from contacting the virus.
Okay, and still on the rural communities, any plan to expand the scope? I'm talking about local languages and passing these messages across.
Our chief community orientation and mobilization officers are recruited from the various local governments that they are stationed, and so they speak the language. So much of the advocacy that we're doing is in languages. Where we find that there's a bit of a challenge for which we would need help, and we are getting some help from state governments like in Lagos, in Kano and Jigawa. Specifically, I can tell you this ones, is how to navigate. A typical local government has like 20 villages, and you need to reach all of those 20 villages with this advocacy messages so that they know what to do and you don't leave out any gaps.
We definitely don't want to leave out any gaps in containing the spread of the virus. Thank you so much, Mr. David Akoji. Thank you.
Thank you very much.
All right, countdown to lockdown of the Federal Capital Territory is now in hours and not in days. But will filling stations be open during this period? Let's get some clarification.
Abuja, a city in its last moments to lockdown. All racing to get what can sustain them for fortnight. But the vehicles doing the racing need not to worry because the filling stations will be open during the lockdown. But the owners are afraid, so the queues are emerging, while some not dispensing.
I'm not aware that filling stations will be open tomorrow.
I don't know about it.
The filling stations will be open.
That is why they say my Ogasio we should be coming to work, 2 supervisor, 2 attendant for all those exercises so that we can be able to give it to public.
Department of Petroleum Resources, DPR, is out on the field. 1, to allay the fears, and secondly, to ensure no hoarding of the product. So, close check on the manifest and physical monitoring of the underground content.
Retail outlets are supposed to be opened, So that's why we are out here today, to make sure that all the stations are opened, and if we find out any station that is closed, we need to come and find out why it's closed.
Unreliable electricity compels many to get petrol for their generating sets.
Since there is no movement, you have to buy for the generators and the cars so that you'll be able to sustain yourself for the period.
But the presence of DPR keeps some wedded to their own jerry cans because DPR frowns at it.
Filling station owners, they should desist from selling to jerry can.
Quite a lot of discomfort, but it's a price to pay for the eradication of COVID-19 by all. Mia Ogede, NT News.
Many thanks, Mia. Sustenance is the key word there. But let's join our correspondent Mahmoud Ibn Mohammed in Bauchi, who is with a guest. Dr. Mahmoud Dalhatu is the Vice President, Nigerian Infectious Disease Society, to speak more on the COVID-19. Mahmoud, it's your turn.
Thank you, Ruth. Welcome to Bauchi. And with me is Dr. Mahmoud Dalhatu, Vice President, Infectious Disease Society. Doctor, you're welcome.
Thank you for having me.
Doctor, as an infectious disease expert, what gaps do you perceive in our national response, and how best can that be closed?
Yeah, so we are aware of a lot of efforts being carried out by public health authorities in the country before we even reported our first case, and those efforts are continuous. And then the recent activation of the presidential task force, so that this response will have the highest level of political will we can have. That is commendable. As we move into the next phase of the outbreak, where we foresee increase in numbers of cases in geometric progression, given what we have seen in other countries, our major concern is that government and healthcare workers continue to work to ensure that there are availability of bed space to take care of these numbers, and there are availability of healthcare workers to take care of these patients. And these healthcare workers should be trained primarily to know how to manage these cases, and then secondarily to prevent transmission of infection either between patients within hospitals or to protect themselves. So we are expecting that should happen. Secondly, we are concerned about the possibility that we may have challenges with personal protective equipment. Even more developed healthcare systems are facing these challenges. So we expect that attention should be given to that, to ensure that healthcare workers have the protective gear they need to protect themselves, to give them confidence to go ahead and take care of our patients. The third important issue is the issue of testing kits. We have seen challenges with testing kits across the globe, causing a lot of problem. So we expect the national public health authorities to do all they can to ensure that more tests are available, more capacity for testing, and then we are appealing to subnational level states and LGS to ensure that they adhere to the guidelines for these tests, because there are a lot of test kits coming from the market, and they have their strengths and weaknesses, and we advise that it's better people adhere to national guidelines.
Okay, are there peculiarities that makes it necessary for Nigeria to look inward for solutions beyond the global guidelines?
So if you are talking of clinical guidelines or guidelines for infection prevention and control, this is a new virus. So the existing evidence that we can base on to derive guidelines are based on what happened in experiences in Wuhan and other countries that have had this outbreak before us. So it will be difficult for us to deviate from that outbreak. That doesn't mean if new information comes, the country is not going to adapt and adjust appropriately. When it comes to implementing public health interventions like the lockdown, social distancing, we expect that implementers will look at peculiarities we have when implementing these interventions, and I see attempts to do that.
Okay, thank you, Dr. Mahmoud Al-Hatu. It's really nice. It's been nice talking to you. Thank you for shedding more light on the issue of COVID-19 in Nigeria. Thank you very much.
Thank you for having me.
Well, that has been Dr. Mahmoud Al-Hatu, Vice President Society of Infectious Disease, right here from Bauchi. It's back to you, Abuja.
Thank you very much, Mahmoud Ibn Mohammed there, speaking with the guests, talking more on COVID-19. And the Nigerian Senate has announced the decision by senators to contribute 50% of their salaries to the efforts on response to the spread and treatment of coronavirus in Nigeria. In a statement by the acting spokesman for the Senate, Senator Godia Akwashiki announced that after due consultations following a keen review of the national efforts to contain the coronavirus pandemic in Nigeria, the Senate wishes to announce that from March 2020, senators will be donating 50% of their salaries to these efforts to stop the spread of the disease in the country. The statement explained that these monthly contributions from the Senate will be sustained until Nigeria is declared safe from the ravages of this deadly disease. It also commended the efforts of President Muhammadu Buhari, ministries, departments and agencies towards the goal of securing the nation against this plague, as the Senate is willing and ready to do whatever is required of the legislature for the effectiveness of all the measures in place now or that may be required in the future to win the fight against the menace. It also acknowledges the patriotic response of public-spirited individuals and organizations who have contributed in one way or the other in support of this fight against the virus. The Senate further appeals to the citizens to comply with the directives on social distancing and observance of basic rules of hygiene as explained by public health officials as the most effective way to protect ourselves, families and country against COVID-19. Let's go on a break with Rakshat Liso. Stay tuned.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose and mouth. Practice respiratory hygiene. If you have fever, cough and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Africa is a land of opportunities. There's no better time to be and become an entrepreneur in Africa.
When I got my seed capital, it was just an idea. I didn't even have a business. There was no happy coffee.
Right now, we are employing 22 young people.
Recevoir le financement qui m'a aidé à démarrer cette activité et aider beaucoup.
Having been an entrepreneur myself, let me help to create more. That is the driving force behind the Tony Elumelu Foundation.
No one but us will develop Africa. We need to look inward to see how we can share prosperity. The future of Africa is in your hands.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real. Thanks for staying with us. COVID-19 has taken its toll on almost every facet of human endeavor. But we have a segment of the society who carries the burden of living with another viral disease, which science has been able to discover effective ways of preventing and ensure that people continue to live a normal life with the virus. I'm talking about HIV and AIDS. And we have in the studio the Director General of the National Agency for the Control of AIDS, Dr. Gambo Gumel Aliyu, to talk to us on the plight of people living with HIV and AIDS in the face of COVID-19. Thank you very much for joining us.
Thank you.
Now, what can you tell us? What is the link between COVID-19 and HIV and AIDS? What is the plight of people who are living with HIV and AIDS, especially at this time? What should be put into consideration for them?
Our call to people living with HIV/AIDS across the country is to make sure, in addition to the call that is being made to everyone, stay at home, keep social distancing, and ensure adequate personal hygiene by washing hands frequently, to make sure they have adequate stock of drugs that will last them for at least a minimum of 1 month. These drugs are very important because we have seen people that have serious consequences with this disease are people that have weak body defense system. And HIV does weaken the body defense system. In fact, that is how it works. It destroys the body defense system and it makes the individual vulnerable to every disease or all diseases that are capable of causing illness in human beings. And because of that, we don't want them to joke, we don't want them to play with their medication. They should go to the centers where they take these medications and get the refill, medication refill for at least 1 month if they don't have now. And if they have for 1 month, they should stay at home. They should maintain social distancing, and they should eat well and remain healthy. And if they notice any symptoms that is looking like suspicious, for COVID-19, they should call the NCDC hotline immediately, or they should call us because they have access to us at NACA, or they should call Network of People Living with HIV/AIDS and report those symptoms, and we will report it to the relevant body. The task force will take charge of that.
So safety is paramount for persons like that.
Safety is paramount.
So it's not a total shutdown for them.
The shutdown is really very important. They need to be at home. Yes, they need to be at home.
No, I'm talking about the immune system now. If they
the immune system works well with this drug. Without this drug, the immune system is weakened by the virus, and because of that, at this material time, if they have dropped out of treatment, they should quickly go back to those centers and start taking their medication. If they are on medication and they have medication in stock that is less than, or that will cover them for less than a month, they should quickly go back to those centers and get these refills. We have drugs all over the country, and drugs are now being moved to various centers across the country, so they should take advantage of that.
All right, that's the much we can take. Thank you so much, Dr. Gambo Gumel Aliyu. He's the DG NACA. Thank you for that enlightenment.
Thank you.
All right, let's head to Lagos right away as we join Hingano John Adams for more reports on Nationwide.
Thank you, Ruth. We have a cheering news here in Lagos as the state government has discharged 5 coronavirus patients at the mainland hospital Yaba. Nosa Usula reports that this brings to 8 the total number of discharged patients from the center.
Patients who had been quarantined at the isolation center for weeks looked stable and unruffled. The discharged patients expressed joy and satisfaction over the treatment they received. Speaking to the media, one of the patients told people not to panic as the virus could be defeated. While thanking Governor Babajide Sanwo-Olu for his support and proactiveness, they pleaded that the workers at the center should be given life insurance.
I came in here on the 15th, and after the test proved inconclusive, was asked to come back the next day. And that next day, I was admitted alongside of the owners. Things turned out to be fine. were taken care of by the officials, the health officials on ground, and all our complaints were attended to. And now I'm a living proof, a living witness alongside my other colleagues that we can beat it. We can beat it. And I want to assure others that this is not their post, this is not their resting place.
Because from the second day I came here, there was improvement up to this moment. So thank you guys.
It would be recalled that Governor Babajide Sanwo-Olu had earlier in the broadcast said that some patients who previously tested positive would be released if their confirmatory tests are negative. In Lagos, Nusa Osula, NTA News.
That's it from here. It's now back to Ruth.
Many thanks, Hingino. We hope to see and hear of more cheering news coming from that end and all over Nigeria. And on that note, we end nationwide today. Many thanks for your time. And as the lockdown begins for Abuja, Lagos and Ogun State, please stay safe. I'm Ruth Aguele. Bye.